When you have pain in the front of the knee, it could be a tendon issue, it could be patellofemoral pain, it could be a plica irritation, it could be a bursal sac inflammation. We are going to talk about the fat pad in this video. Before we look at what can go wrong with the fat pad, we should ask what is the purpose of the fat pad. If you go to Google and you type in Hoffas Fat Pad, you find this study, Inflammation of the Infrapatellar Fat Pad, where they say the physiological role for the infrapatellar fat pad remains unclear but may involve shock absorption and the protection of adjacent tissues. In a different study, they said, though the precise function of the infrapatellar fat pad is unknown, studies have shown that it may play a role in the biomechanics of the knee or act as a store for reparative cells after injury. So what does all this mean? The fat pad is still not fully understood, but we can look at it as kind of a cushion between the bones and the soft tissues of the knee. And the fat pad has a reservoir of stem cells which may help in regeneration of the other tissues of the knee. So when you have a normal fat pad, it helps to cushion the knee from the collisions associated with sport, and it probably helps you regenerate other tissues because of its stem cells. So what about when it goes bad? When you get an impingement of the fat pad, you get inflammation of the fat pad. First of all, this is pretty rare. It usually happens in an older population, people with obesity, people with osteoarthritis, but there are cases where it does happen with athletes. One of the leading experts on the fat pad, Claire Robertson, had this course where she separated the fat pad issues into 3 different categories. You have the acute trauma, which would be a direct blow to the fat pad, or arthroscopy portals where they go through the fat pad for surgery. You have the chronic cases, which would be classic impingement of knee hyperextension, and you have inflammatory, which would be obesity and osteoarthritis. So how do you know you're dealing with a fat pad? One of the issues is the infrapatellar fat pad is usually confused with patellofemoral joint pain, but there are some pretty obvious things that will help you distinguish the differences. As far as levels of pain, if you have a fat pad issue, you'll usually know because it's the most innervated structure in the front of the knee, so there'll be pretty intense pain, whereas a patellofemoral joint pain is more of a dull pain. Another obvious thing is if you have a fat pad issue, it's going to be worse in extension, so standing and walking can be bad, whereas if you take a patellofemoral joint pain, it's going to be worse in flexion, so something like stairs, something like squats can be worse. And if you use palpation, you can do this with the fat pad with the Hoffa's test, whereas the patellofemoral joint pain, you can't really use palpation. So what about the rehab process if you have a fat pad issue? In this podcast with Claire Robertson, she laid out a 2-stage process for coming back from a fat pad issue. A quick rundown of her 2-stage process. Stage 1 is a settling process. Avoid anything that aggravates the fat pad. You should ice it. You maybe take non-steroidal anti-inflammatories. You maybe do taping to pull the patella off the fat pad. In stage 2, if you had trauma, a surgery, or a direct blow, you just have to recondition the limb. If there is a unstable patella, then you need to look at the hip and the foot. So when you have the fat pad, pretty simple, get it to settle down and then get back into training. So what if you don't have a fat pad issue, but you want to avoid aggravating it in the first place? In this paper, they suggested something in their isometric section. They said, in our experience, performing the isometric exercises in mid-range knee flexion around 30 to 60 degrees of flexion is more comfortable as people with patellar tendinopathy often have pain when performing these with the knee near full extension, possibly due to impingement of the fat pad. So if you have fat pad issues or you're prone for them, how can you keep it happy with training? You should do things that avoid impinging it, like a straight leg extension could cause issues. Doing it in more flexion would probably be better. If you're doing a single leg stand on the flat ground, you could have issues there. If you go into heel elevation, now you're in slight knee flexion, probably less issues for the fat pad. If you're doing something like squats on the flat ground, that could cause issues because you could impinge the fat pad. Doing heel elevation keeps you in slight flexion, possibly avoiding those type of issues. If you're doing something like a basic step up on the flat ground going into knee extension, that could cause problems. Again, just elevate the heel and now you're in slight knee flexion, which will be less impingement. Simply walking could be causing issues if you have a really bad fat pad, so wearing shoes with a slight heel could be better. If you're doing TKEs, that could cause issues on the fat pad because you're going into hyperextension or extension. A better exercise would be the Spanish squat. So what about some examples to hopefully paint the picture a bit more clear on a fat pad issue? My friend Alexander Cortez reached out with his fat pad issue. He said, I was hiking going downhill, slipped and planted my right leg, which got caught between rocks, hyperextended at a weird angle, didn't tear anything, but there was a distinct pop and my knee popped for months with pain. Deep flexion never hurt, only extension did. The leg extension is what solved it. When I started, I could barely extend the leg, even with body weight. I did isos and increased range of motion, eventually could do a plate, just kept working on it. Now, so long as I warm up with extensions, it's pretty much fine. Jumping rope also helped. It desensitized it to impact. Another one of my friends, Max Schmarzo, reached out with his issue. I posted something on the Fat Pad. He said, I had this, I think about 2 months ago. I was totally out of commission, thought it was a meniscus. Probably one of the most painful things I have dealt with. It was like a random knife to the knee at any moment. He said hyperextension was a killer. Walking was really bad for a while. Basically avoided moving. A laying straight leg raise would kill me if not careful when fully locked out. He wasn't exactly sure how he got it. I asked him if it cleared up quickly. He said no, it lasted for like a month and a half. I couldn't really do anything for a while. I saw 3 PTs and no one knew what it was. There wasn't any swelling, so it might not have been a fat pad, but that squeeze test would light me up. And the squeeze test being the Hoffa's test where you go into slight knee flexion and have someone press on the fat pad. Max said, call it assumed fat pad. Still not sure what it was, but it was the only test that seemed to test positive, kind of a by default finding. But whatever it was horrible and the worst. So there you go. There's my video on the infrapatellar fat pad. If you need more information, look up Claire Robertson. She has podcasts and courses where you can learn more if you think you have this issue.